How does one get fever? It's actually a very complex process. Here I have tried to simplify it. Okay, let's say the cause is an infection. So when the germ comes in, the white cells in the blood is actually, they are the soldier cells. So they rush to the point of infection, and there they will try to try to block their further passage by also producing interleukin, and the interleukin then stimulates prostaglandin production, which is then a signal for the hypothalamus to create a heat-boosting response. It has been found that by increasing the temperature, the body actually slows down the ability of the virus and the bacteria to multiply. So, in fact, actually the fever helps the body fight infection. Apart from the fever, okay, you've taken the temperature, you would also be looking for some associated symptoms, if there are any, whether there is a runny nose, cough, and what sort of a cough. Is it a dry cough or a wet cough, continuous cough, or the cough is only at night, whether the voice is getting hoarse, and is there a noisy breathing? Because in young children, especially in the age group of about 1 to 3, they can come down with a croupy sort of cough or laryngotracheobronchitis. You'll find the voice gets hoarse, and then they start having a barking sort of a cough, and sometimes can lead to difficulty in breathing. Is the child irritable? Or in young children who are nonverbal, they may be crying excessively. So the excessive crying could be that they are in pain, or maybe the higher temperature is causing discomfort. Nausea, vomiting, abdominal pain, diarrhea. Of course, know how many times the child vomited. If it's once or twice and the child is otherwise active, it may not be so bad. When a child says he or she has got abdominal pain, you can actually observe how painful, okay, whether the child is saying, I've got abdominal pain, but is still running around or playing, then it can't be so bad. Or is the child lying and is not moving very much or holding onto the abdomen? That would be quite painful then. Diarrhea, of course, the number of times, is it very a large amount? Is there blood, mucus, etc.? So that has to be noted. Poor appetite is quite a common problem when it comes to fever. We don't feel so good, our taste buds don't work so well, but usually it's not too bad. There may be excessive drooling, indicating that there could be something painful happening in the throat, like enlarged tonsils, tonsillar infection, or it could be a case of ulcers, like in hand, foot, and mouth disease. If there is a rash, do note when the rash started, on which day of the fever, the site, where did it start first, and how is it spreading? Whether it was a transient rash, meaning it was just there for a short while and then it faded off, or whether it is worsening. And of course, itch, whether is it a very itchy rash, whether the child has red eyes with or without eye discharge, any swelling at the jaw, neck, hands, and feet, limping or being unable to bear weight, might mean that there is a problem with the hip or the joints, the knee or the ankle. In babies who are unable, who haven't started walking, sometimes not moving a leg might mean that there could be an arthritis, and septic arthritis, maybe it's actually a serious problem in young children. Next. Causes of fever, well, there are many, many causes. I've just written very briefly. Infection would be one of the commonest things. So infection and viruses are the most common. The common cold, influenza can cause very high fevers and usually take about 5-6 days or even up to a week with a lot of complications with bad cough and cold. Then you've got the whole lot of gastric flus. You've got others. And of course, now we are concerned about the COVID at this moment. The brief mention of COVID-19 infection in children. Generally, the incidence in children has been low compared to adults. I'm afraid I can't give you exact figure now, but the last that was mentioned in September was about 367 cases, and the incidence was about only 0.6%. But I'm sure it's a bit more now with the resurgence. Symptoms generally are mild for children. There could be fever, cough, cold, and sometimes vomiting, diarrhea, abdominal pain. However, the risk of complications are higher in children less than 1 year of age and those with underlying illness or those on immunosuppressants. So this group would be actually admitted for observation. Of course, if the child is being observed at home, you must seek medical attention if there is poor feeding, rapid breathing, or the child looks lethargic.